Welcome to this educational video on esophagitis. We'll explore this condition, examining its causes, symptoms, diagnosis, treatment, and much more. Let's begin by understanding what exactly esophagitis is. Esophagitis, at its core, is inflammation of the esophagus, the tube that carries food from your mouth to your stomach. The causes of this inflammation are varied. The most common culprit is acid reflux, where stomach acid flows back up into the esophagus. Other potential causes include infections, such as fungal or viral infections, particularly in individuals with weakened immune systems. Certain medications, like some antibiotics or pain relievers, can also irritate the esophageal lining. Less frequently, allergies to certain foods, especially in children, or autoimmune disorders can contribute to esophagitis. And finally, physical irritants, such as radiation therapy or repeated vomiting, can damage the esophagus, leading to inflammation. Now, let's delve into the pathophysiology of esophagitis. When the esophageal lining is repeatedly exposed to irritants like stomach acid, it triggers an inflammatory response. This inflammation damages the cells lining the esophagus, leading to erosion and ulceration in some cases. The body attempts to repair this damage, but chronic inflammation can disrupt the normal healing process. Over time, repeated cycles of damage and repair can lead to structural changes in the esophagus. For instance, Barrett's esophagus can develop, where the normal squamous cells lining the esophagus are replaced by columnar cells, similar to those found in the intestine. This is a precancerous condition. Furthermore, chronic inflammation can lead to esophageal strictures, or narrowing of the esophagus, making swallowing difficult. The specific pathophysiology varies slightly depending on the underlying cause, but the core process involves inflammation and damage to the esophageal lining. Understanding how common esophagitis is can help put the condition into perspective. While exact prevalence figures are difficult to determine due to many cases going undiagnosed, it's estimated that a significant percentage of the adult population experiences some form of esophagitis. Acid reflux, the leading cause, is very common. Reflux esophagitis is prevalent in westernized nations. Infectious esophagitis is more common in individuals with weakened immune systems, such as those with HIV, ACE, or undergoing chemotherapy. Eosinophilic esophagitis, driven by allergic reactions, is increasingly recognized, particularly in children and young adults. The prevalence also appears to be increasing over time. Several factors, including dietary changes, obesity, and increased awareness and diagnostic testing, may contribute to this increase. The signs and symptoms of esophagitis can range from mild discomfort to severe pain. Common symptoms include difficulty swallowing, known as dysphagia, painful swallowing, called odonophagia, chest pain, which can sometimes mimic heart pain, heartburn, regurgitation of food or stomach acid, a feeling that food is stuck in the esophagus, and nausea or vomiting. In children, symptoms might include feeding difficulties, irritability, or failure to thrive. It's important to note that the specific symptoms and their severity can vary depending on the underlying cause and the extent of esophageal damage. If you experience any of these symptoms, it's essential to seek medical attention for proper diagnosis and management. Diagnosing esophagitis typically involves a combination of medical history, physical examination, and diagnostic tests. The doctor will start by asking about your symptoms, medical history, and any medications you're taking. An upper endoscopy is often performed. This involves inserting a thin, flexible tube with a camera attached down your throat to visualize the esophagus. During the endoscopy, the doctor can also take biopsies, small tissue samples, for microscopic examination. These biopsies can help identify the underlying cause of esophagitis, such as infection or eosinophilic infiltration. A barium swallow X-ray may be used, where you drink a barium solution that coats the esophagus, allowing it to be visualized on an X-ray. This can help detect structural abnormalities like strictures or ulcers. In some cases, esophageal manometry, which measures the pressure and coordination of esophageal muscle contractions, may be performed to rule out other swallowing disorders. Esophagitis can be classified into several types based on the underlying cause. Reflux esophagitis, as the name suggests, is caused by chronic acid reflux. Infectious esophagitis results from infections, commonly fungal infections like Candida, or viral infections like herpes simplex virus. Eosinophilic esophagitis, or E, is characterized by an accumulation of eosinophils, a type of white blood cell, in the esophagus, often triggered by food allergies. Pill-induced esophagitis is caused by certain medications that irritate the esophageal lining. Less common types include lymphocytic esophagitis and radiation esophagitis. Correct classification is important because it guides the treatment approach. Treatment and management of esophagitis focus on reducing inflammation, relieving symptoms, and preventing complications. The specific treatment depends on the underlying cause. For reflux esophagitis, proton pump inhibitors or PPIs, which reduce stomach acid production, are commonly prescribed. Lifestyle modifications, such as avoiding trigger foods, eating smaller meals, and not lying down after eating, are also important. For infectious esophagitis, antifungal or antiviral medications are used to treat the infection. Eosinophilic esophagitis is managed with dietary elimination of allergenic foods and/or medications like topical corticosteroids. Pill-induced esophagitis is treated by identifying and stopping the offending medication and using liquid formulations when possible. In some cases, esophageal dilation may be necessary to treat strictures or narrowing of the esophagus. It is crucial to consult with a doctor to determine the most appropriate treatment plan for your individual situation. Preventing esophagitis involves addressing the underlying risk factors. For reflux esophagitis, lifestyle modifications like maintaining a healthy weight, avoiding late-night meals, and raising the head of your bed can help reduce acid reflux. If you frequently take medications that can irritate the esophagus, talk to your doctor about alternative formulations or ways to minimize the risk, such as drinking plenty of water when taking pills. For individuals with weakened immune systems, taking preventive measures against infections, such as good hygiene practices, is crucial. Identifying and avoiding food allergens can help prevent eosinophilic esophagitis. Overall, a healthy lifestyle, proper medication management, and awareness of potential risk factors can significantly reduce the risk of developing esophagitis. The prognosis for esophagitis is generally good, especially with prompt diagnosis and treatment. Most individuals experience significant symptom relief with appropriate management. However, untreated or poorly managed esophagitis can lead to complications, such as esophageal strictures, Barrett's esophagus, and, in rare cases, esophageal cancer. Recent research focuses on improved diagnostic methods, such as non-invasive biomarkers for eosinophilic esophagitis and more targeted therapies. For example, research explores the use of biological therapies for eosinophilic esophagitis. Additionally, researchers are investigating the role of the gut microbiome in the development and progression of esophagitis. These advances hold promise for improved outcomes and a better quality of life for individuals with esophagitis.